Hello everyone. Today we are going to study the sphenoid bone, and this is a picture of the front view of the sphenoid bone. And before going into the details of the sphenoid, we are going to look at its constituent parts and see which parts of the head and neck the sphenoid contributes to. Now in the anterior view you can make out this massive body, the two greater wings, the lesser wings above here, and below the pterygoid processes consisting of the lateral pterygoid plate, medial pterygoid plate, again lateral pterygoid plate and medial pterygoid plate. Now from this broken up part of the body you can make out that the body of the sphenoid is hollow and contains the pair of sphenoidal air sinuses with an irregular partition in the middle. From this irregular patch over here, this is a part of the labyrinth of the ethmoid which is stuck onto the body of the sphenoid. So the sphenoid completes the posterior ethmoidal air cells and it has air cells of its own. And this is the opening of the sphenoidal air sinus. If you look at the greater wings, these smooth patches of the greater wings form the lateral walls of the orbit, and above here the undersurfaces of the lesser wing form the roof of the orbit. So here you have the orbit, here you have the paranasal air sinuses, and below at the root of these pterygoid processes, somewhere here and here, where you have this opening and this opening, this is a highly specialized region of the skull which is called the pterygopalatine fossa. It is not easily dissected and it is not part of the routine classroom dissections. And these pterygoid processes basically give attachment to the muscles of mastication and the muscles of the pharynx and support to the auditory tube. Let us look at some other views. See this one, the superior view of the sphenoid. It looks like a bat with the wings extended. So you have a body in the center, these two greater wings, one on this side, one on this side, lesser wings over here and over here, and you cannot see the pterygoid processes because they are below. Now this surface of the lesser wing and the body forms the floor of the anterior cranial fossa. So you have the anterior cranial fossa over here. The central part of the body forms the middle cranial fossa, and these flared up parts of the greater wings, they also form the middle cranial fossa. And this block of bone on the posterior part of the body, it forms the posterior cranial fossa. So the sphenoid contributes to the anterior, middle, and posterior cranial fossa on this view. Now, if you look at this view, this is the undersurface of the sphenoid. So this is the undersurface of the body in the middle, and this is the vomer sticking onto the undersurface of the body. So this undersurface of the body over here by the sides will be forming a part of the roof of the nose, and further behind a part of the roof of the nasopharynx. On the sides, if you look at the greater wings, these are parts of the infratemporal fossa. Infratemporal fossa here, infratemporal fossa over here, and further above these corners, they are going to form parts of the temporal fossa. So you can see the infratemporal fossa, little bit of the temporal fossa, and you can see the roof of the nose and the roof of the nasopharynx. And again these pterygoid plates, lateral pterygoid plate, medial pterygoid plate, lateral pterygoid plate, medial pterygoid plate, and a small hook on the medial pterygoid plate, a small hook on the medial pterygoid plate you can make out. It's called the pterygoid hamulus. And these pterygoid processes, plates again give attachment to the muscles of the pharynx and the soft palate and give support to the auditory tube and also the muscles of mastication. Now if you go to this, you have already seen this picture. Now we go to the posterior view of the body of the sphenoid. Here you can see the back side of the body of the sphenoid. It has been sewn through and it is going to articulate with the basilar part of the occipital bone, and you can see the posterior parts of the greater wings of the sphenoid which end over here. These tips are the spines of the sphenoid. So you can see the spine of the sphenoid over here and over here, and below over here this sharpened keel-like structure is the rostrum of the sphenoid. You can see that it is articulating with the alley of the vomer, and you can see these pterygoid plates, lateral pterygoid plate and medial pterygoid plate. So this is enough for a preliminary of the sphenoid. Now we will go into its details. Thank you.